Welcome to Health Talk. I'm your host, Jill Fraley-Dotson for Pikeville Medical Center. Today we're going to talk about a disease that affects so many people in our area, and that is COPD. It's chronic obstructive pulmonary disease. November is National COPD Awareness Month, and today we are going to discuss signs and symptoms, treatment options, and everything that you need to know about this disease that affects so many. Joining us today on Health Talk, Dr. Harfouche, a pulmonologist at Pikeville Medical Center, and Christy Prater, pulmonary clinic manager at PMC. Good day and welcome to Health Talk.
Good morning.
We have talked about this before, but it's such a good time of year to remind people about COPD and what they can look for, signs and symptoms, and how it affects so many in our area. So first we'll start with Dr. Harfouche. Tell us a little bit about your responsibilities at PMC.
I'm Obaida Harfouche. I'm a pulmonologist at PMC. I graduated from University of Damascus in 2000, and I did internal medicine residency. Then in 2008, I came to Marshall University. I did internal medicine and pulmonary. So I moved in 2013 to Pikeville area, and I joined Pikeville Medical Center. I'm basically seeing patients in the office, and PMC, our office in the 8th floor. We see patients 3 days a week between 8 to 2 p.m. and then I see patients in the hospital. So basically that's what I do.
We're certainly happy to have you here. Let's get right to it. A lot of people hear the term COPD but really don't understand the complexity of this disease. So tell us first of all, what is COPD?
COPD is a chronic obstructive pulmonary disease, as you said. So it's basically affecting the airway that will decrease the airflow inside and outside the lung. So that will cause symptoms. It's not only that, it will also affect the lung tissue. So it's not only obstruction in the lung or in the airways, but it will also cause damage to the lung tissue and even to the vessels of the lung. And that will lead to all symptoms we see with the COPD patients.
Speaking of that, if someone wonders if they have COPD, what are the signs and symptoms associated with it?
Usually they feel shortness of breath. It's usually slow and progressive, and it might be interrupted with episodes of exacerbation. It means the patient will have more shortness of breath and to the point that he has to come to the hospital. Other symptoms including cough, productive cough. They might get some sputum or phlegm. Usually it's chronic, sometimes extends to 3 months, with sometimes chest tightness and other symptoms like wheezing in the chest. They can hear this wheezy sounds when they are breathing deep in and out. So basically these are the main symptoms, but shortness of breath usually the first symptom.
The first sign that you should look for.
Yeah.
Are there a lot of patients in this area with COPD?
Of course.
Yeah.
Most of my patients in the office, they are COPD patients.
So a large percentage then of the patients that you see?
I can say probably more than 80% of my patients, they are COPD.
Why do you think it's so prevalent in our area?
Number one, I have to say that in this area we have the highest rate of smoking nationwide. Actually, Kentucky and West Virginia, they are the highest. Yes, it's about 27 to 28%. The other thing is coal mine working also has a role in COPD to a less extent from smoking, but mainly it's smoking. More than 80% of COPD patients, they are smokers.
Yeah. Christy, as a clinic manager and someone who's lived in our area all of your life, why do you think so many people smoke? Or if they've tried it at least once, why do you think they continue to do something that's so bad for them?
I think the majority of smokers start smoking as teens through either exposure of peers, their friends, their parents. I think the people with that type of exposure are much more likely to begin smoking than those who are not exposed to that. Kentucky is the nation's highest percentage of smokers, with 28% of Kentuckians smoking, and actually Appalachia is the home for the majority of those.
Do we still see a lot of younger kids? You mentioned teens, they start in their teens. Do we see a lot of kids smoking now too?
Absolutely.
Underage smoking.
Yes.
It's amazing that it's continued toward that way. Dr. Harfouche, are there people in this area who have COPD but don't know it?
Yeah, yeah, and most of my patients, they come after they have had symptoms for a long time. So basically they have had COPD, but they didn't know about it until it comes to the point either they are in the hospital. The first time they come, they know that they have COPD. It is in the hospital where they have an episode with severe shortness of breath and low oxygen and chest pain and tightness. So they get to the hospital admitted. I see them there and I make the diagnosis.
Right.
So it is important to know the symptoms so the patient can seek medical help early so we can start the treatment early.
So a lot of people may think, you say shortness of breath, wheezing, if you have phlegm, they could mistake that for maybe a cold or the flu or whatever, and then they come to the hospital. And at what point should they seek a physician's help or treatment if they think they have something a little bit greater than just those regular symptoms?
True. When you have those symptoms, what you're talking about, cold or flu, correct. You will have symptoms of shortness. You might have shortness of breath. Usually you should not if your lung is normal.
Right.
But if you start having some shortness of breath that extends beyond the normal limit, like 7 to 10 days, and you have persistent cough with phlegm that's not improving after that, usually more than three weeks, then we should think of something else going on. So that's when they have to see a lung specialist.
It sounds so serious. When you talk about anytime tightness of the chest, shortness of breath, all of those symptoms would lead me to believe that COPD could be life-threatening. Is it life-threatening?
It is not immediate life-threatening, but it has some survival rate. It depends on the severity. It means it will affect the life expectancy if you don't get the treatment, if you keep smoking, all of that, and it depends on the severity of the disease. It's very important to know, because the patient will think that this is not going to kill me tomorrow,
right,
but it's going to affect his life and life expectancy on the long run.
Is COPD a leading cause of death in our area, or those symptoms associated with? What about the United States?
I think it's the third cause of death, and still in our nationwide, and it is
third cause of death.
That's very serious.
That is very serious. So let's talk about whether or not we can treat COPD.
We can treat COPD, we can control the symptoms, and we can slow the progression of the disease. So basically, smoking is the first treatment, or smoking cessation is the first treatment of COPD. And I always say that to my patients, that everybody has a decline in his lung function over time, like about 50 ml per year for adult. In a smoker, it's much more. And if you keep smoking, it will keep declining down with time. But if you stop smoking, at the point you stop smoking, your lung function decline will go back to as normal as other. It won't be back to normal, but the decline will be the same rate as normal people. So that's very important in the treatment. There are other medications, of course, to treat to improve the shortness of breath, to decrease the cough and phlegm, and to protect the patient, or decrease the hospital visits or physician visits for shortness of breath. And
that is certainly good news.
Oh, of course, yeah, that's good, very good.
I've had employees from the Leonard Lotson Cancer Center on Health Talk in the past, and they've talked about a wonderful smoking cessation class that is offered there. Christy, could you remind our viewers a little bit about that class?
Absolutely. Pikeville Medical Center does offer smoking cessation classes. The classes typically are about a 13-week program. For more information on that, you could call 218-4682. Again, that's 218-4682.
And when is the next class?
The next class will be the last week of December.
Okay, so you have plenty of time to get involved and get registered, and of course you can call the numbers that Christy just mentioned if you would like to attend one of those classes. Now, in addition to the smoking cessation program, there at the hospital we offer something at the hospital for patients with COPD, and that is the rehabilitation program, Dr. Harfouche.
True. Actually, now pulmonary rehabilitation is part of the treatment of COPD. Let me just enlighten that. Treatment of COPD, usually it is smoking cessation, number one, medications to control symptoms and improve shortness of breath, oxygen if needed, and then pulmonary rehabilitation. And of course, if the disease is very severe, we send some patients for lung transplant, and that's why it's very, very important. And pulmonary rehabilitation, actually, the benefit of it comes from three things. One of them is physical training, education, and psychological support and behavioral change. So the patient, usually when they have symptoms of shortness of breath, they will be afraid of doing any activity. And this will lead to a more sedentary life and will lead to more shortness of breath. So there will be a vicious cycle, and that's why it's very important for the patient to break this cycle and come to physical therapy. Physical therapy will, or pulmonary rehabilitation, it will improve the exercise tolerance, so the patient can go now up to 2 or 3 steps of stairs. He might go up to 1 flight or 2 flights of stairs after finishing the therapy. And it will also give him some education about the way to breathe, when to sense the worsening symptoms, where he has to see the doctor, some breathing techniques, and also there'll be like, it is a group support. He will see all other people like him and how they are improving, and that will encourage him to do more with the therapy. So it is very, very good therapy.
Very helpful. So as we close, what is the one thing that you would want our viewing audience to remember about COPD?
Number one, smoking. To avoid smoking, because it is not going to affect the patient himself only. It's going to affect his partner, his wife, the people living with him, and it will affect the kids, and that might lead to lung disease early in their life. And definitely we all love our kids and families, and we don't want to cause any harm to them. The other thing, to know the symptoms of COPD, which is shortness of breath, cough with phlegm, wheezing, chest tightness. And if he has those symptoms for a long time, then he has to see a pulmonologist.
Don't let it go, and don't try to self-medicate or self-diagnose, because I think a lot of us tend to do things like that. I'm glad that you mentioned the secondhand smoke affecting your family, but specifically your children.
Exactly.
It affects them the same way as it does adults.
Exactly. Yeah.
Great information today. Christy, Dr. Harfouche, thank you both for being here so much. As always, excellent information on how we can prevent diseases like this from being prevalent in our area. Thank you.
Thank you so much.
And for more information on COPD, you can certainly contact Pikeville Medical Center at 218-3500. Thank you for joining us today for Health Talk. For Pikeville Medical Center, I'm Jill Fraley Dotson, Pikeville Medical Center, proud member of the Mayo Clinic Care Network.